costs of healthcare have exploded, and few people have much, if anything, positive to say about their plans. But that's about to change. This is Tales from the Plan, a series dedicated to benefit plans and employers taking care of their employees and families. This is how it should be and will be again, and it starts now.
Hello, everybody, and welcome to another episode of Empowering Your Plan with the FIA Group. My name is Adam Russo, and today we are on our second episode of Tales from the Plan. The first one, as you all know, was Jen McCormick talking about her diapers and wipes, her baby, the fact that she had to have that first baby at a really expensive hospital, and then she realized what her duty was. And it's a great story, and it's been used by many, many mothers here at our office and also dependents of employees here at the office. But this second tale is special to me. I obviously have a lot of feelings for this particular individual and the story. I remember where I was the day that Mr. Ron Peck, who is our co-host here and also our executive VP, called me up. It was like a summer day. It felt like a summer day. And I got a phone call. I was actually cleaning my pool, and I literally almost fell into the pool in the shallow end. That would have been worse, Ron, than in the deep end. Because in the deep end, I could have swam.
Tale of the plan itself.
That's another tale of the plan, right? But today we want to have a more, I don't want to say somber, that's the wrong word. I think it's almost an inspiring story about, how people face adversity within their own family. I mean, it's horrific, to be honest. I mean, it's something that's, can't even imagine what I would do, how I would respond if that happened to me. But at the end of the day, you were triumphant. So with that, I want to make sure everyone knows that Ron Peck is going to be sharing his personal experience between him, his wife, and his little boy, and how they dealt with a major medical issue. And then, obviously, with the benefits of our plan, we're able to take that and have a successful outcome, I guess. So, Ron, you want to share your story with our listening audience? And thanks for being here.
Thanks, Adam. So for those of you who are longtime listeners of the Empowering Plans podcast, you might recall that a while back, I actually did an episode where I let the audience know that my wife was diagnosed with non-Hodgkin's lymphoma, a very specific type, primary mediastinal, B-cell, whatever, non-Hodgkin's lymphoma. But really, you don't need to know unless you need to know. And hopefully that means none of you need to know. But told a little bit about how this came around, what happened, and importantly, what role a good health benefit plan plays in getting through something like this. And I did say at the time, again, it was just sort of a cursory review of what was going on, letting people know I might not be as easily accessible as I usually am. And why. I definitely let people know that I would be doing a follow-up and I would let everybody know what happened. And most importantly, I would also share the role, the experiences, the things that are important to know in a similar situation so that when others have the same type of experience, hopefully they can have the same type of experience, which, despite from the initial sounds of it, actually ended up being all right. And we got through this and things turned out all right. And I would never want Adam to say it, but I'll say it. I think in large part because of the support of our health benefit plan, which sounds crazy, especially these days when all people do is complain about their health insurance. I would actually say that the quality of our health benefit plan, the way it functions, the way it coordinated with all the other parties, including the providers, actually at the very least, didn't hinder, and I would even say helped my wife and I get through this. So for those of you who didn't listen to the previous episode, just quick overview. Basically what happened was for a series of almost 6 months, my wife was complaining of feeling ill. Okay, she was coughing, basically very like cold-like symptoms. And, again, lesson number 1, very in tune with how she was feeling, making people know that she wasn't feeling well. She's visiting her primary care physician. PCP is saying, it looks like a cold. You'll be okay. Just wait it out. A month goes by, no change. In fact, it's getting worse. A lot of people would probably say, well, the doctor said it's just a cold. I'm going to tough it out and get through this. My wife, she's tough, but she chose not to tough it out, goes back to the doctor. Same thing. It looks like it's just a flu, like it's turned into a bad flu. Here's some, medication to help alleviate some of the symptoms, but it's got to go away on its own. Again, somebody gets that kind of diagnosis from their doctor. First thing they're thinking is, well, doctor is one step below God. That must be what it is. And they just tough it through. A month later, still not feeling well. It's asthma. It's allergies. Went through the whole thing. My wife noticed a bulging in the vein on her neck, okay, which she asked me if I was noticing it. I've looked at the same woman for 20 years, right? I've never noticed this difference. She noticed it right away. Okay. I say, I don't see anything, and shame on me. I'm in the industry, right? I hear these stories all the time about people being misdiagnosed or not seeking appropriate treatment and becoming these catastrophic claims. And yet, when it's my own family and my own wife, I'm thinking what everyone else thinks. Doctor's got to be right. Doctor's always right. Just do what the doctor says. And I would argue that maybe it's at least in part because the doctor's diagnosis was a very minimal one, right? Doctor's diagnosis is you're young, you're healthy, this is just a little thing, it'll pass. And maybe I wanted that to be true. But my wife, again, very self-aware, she goes, they finally take a chest x-ray, which in hindsight, I sure wish they had done it sooner. They take the chest x-ray, immediately they're calling us. And as Adam mentioned, it's late spring, it's warm outside, it's almost dinner time, and we're being told we have to get to the ER right away. Now, as Adam mentioned, I had, at the time, a 2-year-old. He's 3 years old right now. I'm very lucky that my parents were actually visiting at the time for no related reason whatsoever, having nothing to do with my wife's health. So they're going to watch him, my son, while I take my wife to the ER. You sit there in this emergency room for hours, and for those of you who are in the industry, you know the number of people, the number of issues and conditions coming through that emergency room. It's like the rainbow, right, of issues. And they go from the most minor to the most horrific. And if you're not sick when you go into the ER, chances are you're going to leave feeling ill because you're going to catch something. But we're sitting there. It's finally 1 o'clock in the morning. Pat, Adam, I'm serious. We got there. It was like 7 o'clock at night. 1 o'clock in the morning. They're checking her out. They're going through scans. They bring us into a private room, and they let us know it looks like it's some sort of cancer. Now, when you get that diagnosis, you don't know what to do. And it doesn't matter if you're in this industry or not, if you understand medicine or don't. And of course, right away, my wife and I are asking all the questions you would ask. What type? What's the prognosis? What do we need to do? Are we supposed to be going to the hospital now? Do we do something now? Or you're so lost. And the first thing I'll tell you that I learned about our industry is that people matter, and the way that they're able to divorce themselves from the situation and just embrace you as another human being makes all the difference. Because this emergency room surgeon, you could tell his hands were tied, either by law or policy. He felt he couldn't tell us anything. He couldn't tell us what type of cancer he thought it was. He couldn't tell us what the prognosis was going to be, because the issue was that if he misdiagnosed or he told us the wrong thing, what was going to happen was eventually, are we going to come back after him? Are we going to say, oh, well, you told us it's going to be this and it's going to be fine, and you were wrong? Right? So whether it's by law, policy, or just personal decision, he just refused to give us any details. The nurse who was there could see what we were going through. And she says to the surgeon, they don't want a diagnosis. They just want to know what's going on. And she flat out said, it looks like a lymphoma. I don't know what type. You're going to need a biopsy. That's the next thing. Generally speaking, these can be cured. What the chances are, the prognosis, 50%, 80% survival, don't know. That depends on the type. But this is not a death sentence. That's it. Nothing that I'm going to hold against her. And as it relates to the benefit plan, and this is the first thing I want you to understand, you need to make sure that your benefit plan incentivizes people to avoid the ER whenever possible, incentivize the use of urgent care clinics, incentivize the use of PCPs or direct primary care. Try to keep people out of the ER for a couple reasons. One, like I said, the number of things I saw in there that you don't want people to be exposed to. You get a healthy person who just wants to go get a flu shot and they're just going to go to the ER. They're going to leave with something worse, and your benefit plan is going to have to pay for it. So keeping people out of the ER. Second, you provide robust benefits for the people who do need the ER in emergency situations. So try to keep people out whenever possible, but when people do need to go to the ER, you make sure it's covered. Because if it's an emergency, it's an emergency. And that was what we were dealing with here. So what happens next? Well, they start to contact us, this hospital, this facility where we visited the ER. They have a cancer center. It's fairly well known. And we're told, hey, next step, come in, meet the oncologist. They're going to look at the scans that you've already had done, give you their diagnosis and prognosis, and then we're going to start setting you up for the biopsy. And what's amazing is when you hear about something like this, you're thinking it's like having your arm chopped off, where you need to put on a tourniquet and deal with it right now. The waiting is the worst. You're waiting days, weeks between these appointments, and it's a horror because, of course, you're thinking every second matters. Now, I've told you already, my wife was dealing with this for 6 months. And it wasn't being treated. Now, all of a sudden, 6 days feels like forever, right? And another lesson to learn from our benefit plan. The delays between appointments and procedures, they are caused by 2 things. One is the physician's calendar, right? The doctor can only treat so many people in so much time. And so they try to fit you in as early as possible. But second is administrative, dealing with the plan, dealing with the insurance. Having the right partners, getting them on notice that this is coming down the pike, making sure that they're responding to the provider and providing the provider with the necessary information as quickly as possible accelerates the overall process. And I will tell you right here on the podcast that our third-party administrator, BBA, here in Massachusetts, Dave Panucci and his shop and his people, when we let them know what was going on, the support that they provided and the fact that they were ready to go, any question, any concern, getting those administrative wheels turning, shortened the delay between treatments immeasurably, which when you're in a situation like this is huge. Additionally, our stop-loss carrier, who up until this point had not received a claim, we had not hit spec yet, but we knew there was a very good chance that this cancer treatment was going to eventually hit spec. We made the decision to put stop-loss on notice ASAP. And it's something that the carriers frequently ask for at events, at conferences. They say, hey, let us know sooner rather than later so we could be your partner. And people kind of think, I don't know if I trust you about that. Let me tell you something. Letting them know that this was coming down the pike and getting their support as early as possible was also invaluable. So those are 2 more lessons that we learned. So eventually we get the biopsy. And based on the scans, based on my wife's demographic, based on the biopsy results, they were very confident that this was Hodgkin's lymphoma. Hodgkin's lymphoma. If you don't know anything about Hodgkin's lymphoma, they basically say, if you got to have cancer and you can't have skin cancer, Hodgkin's is the next best. Because it's like a 90-something percent, 97% cure rate. The prognosis is awesome. So, of course, my wife and I, when we get this news, felt like we had won the lottery. The cancer center where we treated is affiliated with Mass General Cancer Center and have, as part of their process, an automatic second opinion. So when the pathologist at the one facility does their biopsy and review, it then goes to another pathologist at Mass General and their specialists, and they do a second opinion. It's a very good thing that that was in place. And if I'm to tell you another thing to learn from this experience, it's make sure that your plan covers second opinions, because they were the ones who identified the fact that my wife had this non-Hodgkin's lymphoma. 1 out of a million. Prognosis drops substantially from the 97% we were expecting. But had my wife started treating for Hodgkin's, she would have been going in for 3 hours plus every week, receiving chemotherapy that's ineffective for her cancer, and in the meantime, not treating for the actual cancer she has. That's the medical issue. Not to mention the fact that the plan is either going to be paying for chemo that's not doing anything, or once it's determined that, oh, this was not actually the proper treatment, denying the claims for lack of medical necessity and putting my wife and the cancer center at odds. Nothing good could have come from mistreating this cancer. Fortunately, second opinion avoided all that. Cover the second opinion. Cover it in full, people. You will be glad you did, because our plan was, they determined exactly what my wife needed, which was a week-long inpatient stay every 3rd week for 6 months. Pat, can I tell you something? Raising a 2-year-old boy while your wife is inpatient every 3rd week for 6 months is not easy. But full credit to this company and to this industry, because while we're tough on each other and we expect a lot from each other, everybody had my back. And I was told I didn't have to look at a single email for those 6 months. Of course, I couldn't last 6 hours, but the point was I was told I didn't need to do it for 6 months. And everybody supported me, helped me and my family get through this. So again, as an administrator, whether you're an employer, an employee, TPA, a stop-loss carrier, MGU, broker, doesn't matter. When people are dealing with a situation like this, make sure at both the health benefit plan level and the employer level, you have a support system in place for those people, because their ability to adequately treat and get through this as quickly as possible and as successfully as possible depends upon it. So yes, it was very generous and altruistic to take care of me and my family, but at the same time, in some ways, it was also self-serving, because by getting me and my family through this quickly and successfully, the company only had to do with a distracted Ron for 6 months instead of a distraught Ron for 6 years. So again, spend a little now, get a lot later. My wife started treating, and I got to tell you, everything was covered, everything. And it's because a lot of the cost containment is done ahead of time. The fact that we looked at a number of different facilities, not just the facility in general, and not just the facility as it relates to oncology, but the facility as it relates to oncology and treatment of this specific cancer, success rates, expense. We ended up treating at Mass General Cancer Center. You always hear on our podcast or elsewhere how expensive Mass General is. But when it comes to oncology and cancer care, you'd be surprised to learn everybody's expensive. And suddenly, the more important element when it comes to cost containment is getting it cured as quickly and successfully as possible. And it just so happens that this facility had one of the best physicians, best providers for treatment of this particular non-Hodgkin's lymphoma. And as a result, not only was the price not astronomical compared to other providers, but the likelihood that we would nip it in the bud, get it taken care of, and not have to treat elsewhere or receive other types of treatment. It's a miracle what they're doing now in cancer care, but it's also expensive. Being able to avoid that by getting it done the right way, the right time, the first time, was going to mean a lot for us, obviously. You want to be cured, but it also meant a lot for the plan. Better to spend a little extra now than have to keep spending later. So we did that research. Having those resources available and incentivizing your employees to go to the best facility, which frankly they should want to do anyway. But we did on top of everything else. Because of the plan, I'm willing to say cured my wife and saved her life. So we treated at the right facility, treated the right cancer, all being covered, the plan, the scheduling, stresses off my back and off my wife's back so we could focus on getting well, all to the benefit of my family and to the plan. And 6 months later, it's already November, Thanksgiving, hooray. She receives her last treatment and gets her first PET scan, and it looks to be all clear. So now they're not allowed to use the word cure until a certain amount of time passes, continue to receive tests and scans every 3 to 6 months until they can guarantee that it is gone. But I will tell you that for many families that go through something like this, you always read the story about the ridiculous out-of-pocket expenses that they face after they're cured. It's not happening here. And that is because our plan, we go above and beyond when it comes to reviewing data and ensuring we're only spending money where we have to, so that the money is there to pay for things we need. The fact that we're not paying for some sort of, smoking cessation program when none of our employees smoke, that money we would be paying to a vendor that we would never use in another scenario goes back into the trust to be used in situations like this. The fact that we have a robust subrogation program, obviously, that if somebody's hurt in an automobile accident, we're going to make sure that that auto insurance carrier is paying instead of our health plan, ensures that money that we don't need to spend is in the plan to pay for something like this. So the idea that cost containment is just about spending less is wrong. Cost containment is about spending wisely on the right things and ensuring the money is there to spend on the appropriate things so that you don't have to put your hand out to your employees and ask for more to make up for your earlier mistakes. And our plan does that. And as a result, co-pays, deductibles, minimal. I would tell you that my wife and I, but this entire situation, we've paid out of pocket to treat cancer the same amount most people probably would have to spend to fix a broken leg. And that blows me away. And we're not special. We just care. We put the work in ahead of time so that when a situation like this does come up, everybody wins. Her providers were literally commenting to me and my wife what a pleasure it was to deal with our plan. The fact that Everything was clearly stated. The ID card clearly explained the benefits. The TPA had someone already assigned to this case. The fact that the payments were coming in on a timely basis. They knew exactly to whom they should submit the bills. They knew exactly what they were going to receive, which network rates applied, which didn't. Everything was so clear-cut and administratively clean. Not only were we, my wife and I, able to focus on her treatment, but her providers were able to focus on her treatment as well. So I guess in closing, what I've learned from this experience is that health scares like this are life-altering. And when you're in the thick of it, it's too late to do anything other than focus on saving your life or the life of your loved one. And for those who think, I'm going to deal with dialysis, I'm going to deal with cancer, when it happens, it's too late. We did things here to contain costs and ensure that if a situation like this came up, we'd be able to deal with it. We did that ahead of time. And as a result, when it happened, we were ready. I just never thought it would be me, but you never know. So I would say that obviously in the time I've been allotted, and I've already used up a lot of your time, and I thank everyone who's listened. I thank everyone in the industry who's reached out, who's checked in, who's asked how things are going. Thank you. It means so much. Stacey Borens, shout out to you for being there. Literally, guys, every morning. Here you have someone who's an industry member, focused on cost containment. She's also a medical provider. She understands what we were going through. Every morning, she was texting me and my wife, asking for updates. The amount of support we got from her, Marianne Diaz, and the Symetra crew. I already mentioned Dave Panucci, BBA. Everybody had each other's back. And that's how this industry is supposed to work. Because when we all work together instead of against each other, it all works out. So thank you. Thank you to all of you. Thank you to everybody else who was involved. And thank you for those who continue to reach out and ask how things are going. Things are great. And I would tell you that, and I know it sounds cheesy, having the right plan meant a lot. And when you have a cancer patient that you love, the mother of your child, losing her hair, barely able to stand, looking at EOBs and saying, wow, that's covered, you realize it's not a joke and it does matter to their health. And that's why we're here. And that's why you need to stop reacting, be proactive, reach out, and let's figure out how to get your plan structured so it could deal with a similar situation as well.
Well, Ron, that was amazing. I'm sure every person that's listening to this either cried or had goosebumps, or it affected them in a way that neither one of us could expect, just because of the fact that it might have been in their own family, a friend of theirs has gone through cancer, and how horrific it is. But I just want to say that what you said today and your story inspires me. I'm sure it inspired Pat. And I appreciate the fact that you were able to open up your heart and tell us something that's not easy to tell. So thank you for that.
Thank you, Adam. I appreciate it.
That's all for today, folks. On behalf of Pat Santos, our wonderful producer, Mr. Ron Peck, who's just a great guy. I'm not even going to tell you his title anymore. And myself, your humbled servant, Adam Russo. Thank you so much for empowering your plans with the FIA Group. Have a great day.
Thank you.